It's the I Can't Mom Today podcast with Heather, the new mom, and Vera, the seasoned mom. I Can't Mom Today.
Hey, this is Vera and Heather back again with another episode of I Can't Mom Today podcast with Dr. Z again. Thank you for coming back. Yeah.
Thank you for not cooking me out after one episode.
Yeah. Never.
Well, it's like never ending. Well, I just find a lot of the things that, if nobody's listened to the previous episode that you were on, and we talked about nutrition and Heather sending away her poop test and when my experiences with you and the things that I've learned from taking both Lucas to your practice and for myself with my RA and the aspects of the muscle testing and nutritional things that you can do with your diet that can change so much. And then I realized that you were starting to focus on autism and ADHD and all that. I didn't even realize that could be affected.
Absolutely. And, really, I don't think what everyone understands is that these issues are really functional. If we go, there are people who have genetic, kids who have genetic disorders who have symptoms of autism. Mm-hmm. They might still get labeled with autism. And so, but those are a huge minority of the patients. It's a functional problem. We do MRIs of the brain, traditional MRIs, and the brain will look completely normal. And this is, true in autism, ADHD, dyslexia, OCD. The brain is perfectly normal except for the fact that the connection. So there are functional MRIs. So you can try to stimulate the brain and see how the brain lights up, how it connects to each other. And those can be abnormal in these issues. But essentially where you have a problem is that there's parts of the brain that are not wired enough, and there's other parts of the brain that are too wired. And so the key to that is finding, where's the deficits, where's the overactivation, and then, through different exercises and through different types of sensory integration and neurostimulation, you can retrain those connections to go to the more appropriate pattern. I think it's estimated everywhere from like 10 to 15% of kids with autism, for example, come off the spectrum at some point.
Really?
And really there's no real, we don't know quite why, but there is a correlation with basically there was some sort of rehab going on. It didn't happen by accident, so to speak.
Okay.
And so that's the big thing is finding out where the starting point is.
So ADHD, autism, OCD, all of that is related? They're related to each other?
It can be. There's different parts of the brain that are off, and actually I subscribe to a hemispheric model, which means that I think some issues tend to be more of a delay of the right brain, and some issues tend to be more of a delay of the left brain. So when you're talking about autism and ADHD, for example, you'll notice that there's a lot of similarities between those kids. Like if you see a kid with high functioning autism, for example, sometimes he'll just look like a kid with ADHD, and he'll have a lot of the same symptoms. And both of those tend to be a right brain delay. So in other words, the right hemisphere is not working, is out of balance with the left. And frankly, we're all like that to some extent. There's always some imbalance. And this is why, some people are more analytical and some people are more artistic and all those types of things. But with these types of issues, those imbalances are just more severe. And so a lot of times you can take that hemispheric approach and apply it and then create more balance. And you're not necessarily changing who the person is. I think a lot of people think that when I make this description, it's not changing them from an analytical person to an artistic person necessarily, but it's creating less extremes and creating more balance between the two. Is the key there. And so this is research that's been pioneered. There's a doctor, his name's Dr. Robert Melillo, and he wrote a book called Disconnected Kids. And that was the book that got me into all of this, essentially. I had our oldest son, he's 5 now, was diagnosed with autism after he regressed and stopped talking at almost 2 years old. And so I was like, once we started to get some of the initial common treatments, it was basically, to me, it was kind of like, okay, this is what it is, and we're going to help him cope with his deficits better instead of trying to make him stronger where he was deficient.
Yeah.
And that never made any sense to me. Why wouldn't you try to strengthen, the weaknesses here? And so I went and I read his book, and then I've taken just about 200 hours of continuing education,
Wow.
doing with him, and got certified in child neurodevelopmental disorders through the International Board of Functional Neurology and Rehab. And essentially what the idea here is that not only is there weaknesses between the two hemispheres, but there's also a prevalence of what we call primitive reflexes. So, when we're born, we have all these reflexes that basically help us survive as infants. So there's a reflex that's on the low back called the spinal gallant that helps the baby get out of the birth canal. Okay. So if you stroke the lower back, you'll see that the back kind of dip a little bit. Or there's a reflex, the root reflex. So that's when a baby gets stimulation around the mouth. They know to, like when they're breastfeeding, they know to turn towards the mom to feed. So these are all reflexes that help survival early on. And one of the ways we know, and there's tons of research that show that demonstrates that when these reflexes are there longer than they should be, then this is a sign that development is not going quite according to plan. So it's really, really important. That's one thing that I really stress to new mothers is have your pediatrician check primitive reflexes. And they never do. They never do, because we all just assume they go away. But every single kid I see with a developmental delay will have primitive reflexes, at least a few of them there. And there's a lot of correlation between that and different developmental disorders. And that's the one common link.
Is it supposed to go away?
Absolutely. Should go away on its own. And this is why, you hear about, they're really sad stories, but when you hear about kids from orphanages that were never taken out of the crib, they were just weren't allowed to get out and crawl. They weren't touched. They didn't get all that sensory stimulation that a baby normally gets.
Yeah.
That's why these reflexes don't go away. So you can even see it in signs like when a baby doesn't crawl, properly, they just kind of scoot, or they do like an army crawl. They don't ever do that normal cross crawl pattern. That's a sign, and that's usually a sign that a reflex didn't integrate properly.
And to be fair, let's clarify that an army crawl, I think, is a natural stage 2 crawling. So are like, oh my gosh,
yeah, I want to freak people out,
right?
Yeah.
But if it never, and that's true, and all of these signs are normal. It's even normal for kids who have tics or repetitive, are like arm flapping, for instance. That's normal for a child to have that. It's just not normal for it to stay, if that makes sense. So all of those things are normal state, can be normal parts of development. It's just not normal. It's not normal for kids to skip stages like that. You hear kids about going straight from sitting up to they skip the crawling part altogether and they just start walking.
Yeah.
And we think, oh, well, he's really advanced. And actually that could be a sign that something didn't quite develop quite right there. And so that's also something that people will miss quite a bit too. So really, by about 12 months, all of those reflexes should be pretty much gone. So
if they're not,
that's something I do with every new child.
If it's not, could that be a first sign? Sorry, Brad and Baker just got home, so you're going to hear pounding feet. Would that be a sign that maybe there is going to be some issues in the future?
Right. It's definitely a reason to pay more attention. It's not diagnostic of anything by any stretch of the imagination, but literally you can stimulate that reflex. And if you do it consistently over time, and there's different techniques to do it. I mean, you can go on YouTube and find all kind of primitive reflex exercises, or you can literally just stimulate the reflex. So when a doctor's testing the reflex, and it's not difficult, I can train a mother how to do this in 10, 15 minutes. When you test it, you're stimulating it. And so you stimulate it till it goes away. And sometimes you can use vibration or other things to help that process go quicker. But certainly if you have it, you want to start intervening. There's no doubt about that.
Wow. That's crazy.
I know. Like I'm like going back memory lane, trying to remember.
I'm going to go practice on Baker right now.
Yeah. Well, I wanted to know too. So you had touched on there are things to do to help this. So if your child is diagnosed to be on the spectrum or has ADHD, what are some of the things that you've been working with and that you've learned about that you do? You've learned can be done differently as opposed to the traditional, like you were saying, how it's just, well, we just got to deal with the disorder instead of like actually helping the child develop better.
Right. Okay. So we have about 2 hours, right?
Yeah. Right.
I'm kidding. No, I think the one consistent thing is, especially on the side of autism and ADHD, is get the gut better and get that as good as you possibly can. There's a very high prevalence of gluten and casein. So casein is like from dairy sensitivities, and it's a little bit different reaction. You don't even notice like gastrointestinal problems when they eat those foods. And it's not like a celiacs, but there are gluten and casein peptides that will actually cross our gut barrier, kind of like a leaky gut type of situation. Yeah. But they'll also cross the brain barrier, and they actually attach to opioid receptors in the brain. Mm-hmm. So actually, when our son's had too much gluten or dairy, if he's gotten into some of that, we see behavioral issues. We don't see necessarily digestive issues. Mm-hmm. And so that is something to definitely try. If I have any child with that, I'm like, hey, if you're not going to do anything else, but at least do that for 4 to 6 weeks, that's at least something to try. It's not every kid, but it's a good number of them, and it's worth a shot of it. The other thing is, like I said, have them check for primitive reflexes. That's definitely a big thing. And then you can do things hemispherically. For instance, if you want to stimulate the right brain, you can take a vibration, like any kind of, like even just like a massager, and just vibrate. Now you actually, because it crosses over, so you stimulate the left side of the body. And so you could just do like go up the back and then go on the arms and go down the legs. Now, if you have a child who's maybe more severe with like autism, that kind of seems like he probably has delays on both sides of the brain, then you can do that on both sides. You want to do more on the left side than you do on the right side, type of thing.
So is this similar to brushing? I saw something with this person that they have to brush their child at
right.
the end of the night.
That's actually what I'm exactly the same. You would use that same technique, but the brushing is great, but adding some vibration into it just makes it a little bit stronger of a stimulation. And so that can be really great. You can use sound. There's right brain music and left brain music. You can even find that on YouTube. And that's really cool. There's some really exciting things coming out now with using cold lasers on the brain. There was actually a study done in Cuba it was by American researchers, but it was done in Cuba because there's just less red tape, frankly, to do research on children. But they literally took these cold lasers. They don't get hot, but they increase.
They'd be called hot lasers then.
Exactly right. They what they do is they increase the energy at the cellular level, and so they make new neuro connections. So it helps new neurons connect to each other in the brain, and also help can stimulate some of that neuroconnectivity. But it was a double-blind study. It was small, but they took 40 kids, and it was like 20 in the treatment, 20 in the
placebo
sham. Yeah, the placebo group. And all 20 in the treatment group got better, and all 20 of the ones in the sham did not get better. So it was a very strong study, and so I think it shows a lot of promise, and it's a really easy thing to do, and a lot of times you can get results really, really quickly with that. You just need that's something you need somebody who knows what they're doing with it, though, so they can hit the right areas. Because if you stimulate the wrong areas, you theoretically could stimulate the areas that are already overactive, and you're not going to hurt the child, but you're not going to get results, essentially. You're going to keep that imbalance going. So, primitive reflexes, some outside the box things like that, getting the GI tract really good. Something that's really underrated is just play, just physical activity, core exercises. The core, when you strengthen the core, it actually stimulates your cerebellum in your brain. And so that actually is a reason why people also get mental benefits from things like yoga, different exercises like that. And that's why, because you're activating the core, and getting more neurostimulation there. Also do activities, pick activities and therapies that do these types of things. So like, my son did really well with horseback riding, and you almost automatically activate the core because you got to create that balance in the saddle. So that's why you're doing something fun and also getting them a great neurostimulation. Music therapy is awesome. All of these things are like that are good ways to get that correct sensory input. And then, if you know your kid didn't do something like crawl, teach him to crawl, go backwards, and practice cross crawling, and doing that method. And so there's A lot of things like that you can do is if there was a skipped stage in development or something that didn't go quite right, try to go backwards and do it again. And so those are all things that can be helpful if you're just trying to, figure it out without a plan.
Yeah. Well, even all those things, just like you said, even just doing some activity that would be good for their core. I mean, something fun, and it's certainly not going to hurt the kid,
Well, and let me put it this way. I mean, the strongest, the way our brains grow is sensory stimulation. So sensory comes in, whether it's sound, light, touch, smell even. That's another thing that I don't think I mentioned, but a lot of kids with developmental issues, they don't smell, they won't notice smells, or they don't accurately pick out smells. And so, or even some aromatherapy can be really helpful, but those are all the ways our brain grow. And when we look at the strongest sensory stimulation, so we get the most neurofeedback, the most stimulation to our brain from the actual muscle fibers. So it's actually moving the muscles and working the muscles that get the biggest activation to stimulate the development of the brain. So this is where I get really worried when you see schools cutting out recess and trying to get kids to sit more still. Yeah, and art too. And, it's really important, especially early on, that kids really just play, and be really physically active. And I think we're getting less and less of that. And sometimes we think we're doing it, we have good intentions. We might be like, oh, he's playing brain games on an iPad, and we think we're doing something good, but really, we're probably having a net negative because they're not moving as much. And I could get all day on the screen time issue and how that gives setbacks. And so, I think the biggest thing that parents can do, even to be preventative, is just get their kid playing.
Yeah.
Now I follow things, or, read articles and listen to other podcasts. And have you heard of a brain SPECT scan?
I'm not sure if I'm familiar with that one directly.
Have you heard of the Amen Clinic?
No, I haven't.
Okay. Oh, I just wonder because the person that we follow, she had ADHD, and they were talking about there were like 7 different types, and sometimes medication makes it worse. And there's a brain a scan that you can do on your brain that can show you where your deficiencies are in your brain.
Yeah, I think I do know what you're talking about. Yes, it uses some sort of it's like a light emission type of thing or something like that they can basically see what side. And I think it's similar to what we're talking about. It has it can show if one side is more imbalanced versus the other, if I remember correctly.
Yeah, it shows where the blood flow is going more or less, and and it can look at concussions and what damage has done to your brain. And it's really interesting because she was saying how she basically has healed her brain from these concussions, and just by eating better. And I think she did oxygen chamber therapy. What is it?
Right, absolutely. And that's another way you increase the reason those barometric chambers help with the oxygen is because they're, again, in helping increase cellular energy, because we need oxygen to create energy too. And so that's really important as well. But yeah, there's a lot of things out there that can be helpful. And the biggest thing is just identifying where the weaknesses are. I'm a real big fan of that. Is, to me, it's not, there's, honestly, there's some things with our son that, do we need him to try to, cope a little bit better and manage things better? Yeah, that's true. But I feel like you can go too far and you just ignore all the weaknesses and just try to stretch out his strengths as much as you can, but you're still not dealing with the problem. And so those weaknesses can change. You just gotta stimulate them. And the problem is, and where a lot of people struggle, and I get it, but you have to do it, if you want to retrain the brain, you have to do it very consistently. It's kind of like if you want to become a triathlete, you can't train once a week, right? You gotta do it.
Is it couch straight to triathlete?
That's right. It doesn't work very well.
Is my plan. I did read somewhere, or heard on the news that they're trying, not to go back to the poop situation, where they have they do fecal transplants to help with
100%
issues.
Yeah, and a lot of I've had, there's been a lot of kids who have responded really well to that. And I think, essentially, so the question I always came to my mind with those things is, why is it that, and I saw this even treating kids, this is before I did this additional training. When I was treating kids, and that's my approach, I'd always be like, okay, we got to pound the gut. We got to get that really good.
Yeah.
Because all of these kids have digestive issues. Their GI tracts are always screwed up. Why is that?
Yeah.
Well, what I finally figured out is that it's a brain issue. So when we're all born, we talked about last time about leaky gut, right?
Yeah.
Well, we're essentially all born with leaky gut. Okay. Because we're all sympathetic dominant. So you got two parts of your nervous system, that you have the sympathetic, which is like your fight and flight response. So like, if a bear breaks into your house, you got to run.
Yeah.
That's the fight and flight response. And then you have your parasympathetic, which is digestion and healing and your immune system being able to fight. And so when we're born, the parasympathetic system is really not developed completely. And so we are all sympathetic dominant. You'll notice that babies or, younger children will tend to have bigger pupils. So that's that sympathetic nervous system being a little bit stronger. And then as development happens normally, we develop a parasympathetic nervous system. Our gut gets better. And this is exactly why children can't digest, foods when they're really young.
That's because they didn't have teeth.
Well,
there's that.
That is also a factor, yes.
The gag reflex, right?
But there's all these, that's part of the issue is that I think what happens with kids with autism is they basically, they just continue to have leaky gut. They stay sympathetic dominant.
Oh, yeah.
And that's why a lot of, and this is why a lot of kids with ADHD and autism will have a lot of anxiety issues too, because their bodies are, imagine being in a state where even when you're laying down and you're in a stage of fight and flight, like someone's trying to break into your house. That's a little bit of hyperbole there, but that's essentially what's happening is that, they're at extreme fight and flight mode, even when they're at rest. And, I really notice that with my son. He's sitting there watching a cartoon he likes. I just talked about screen time. Then I talk about my kids watching TV. But do what I say, not what I do, I guess.
Right.
But
you have to sometimes. Just
but I'm sitting there, and he just looks so anxious, and he was at rest, and that was good for that was at rest for him, but it was still a high level of anxiety that he was in.
Yeah,
and so. That's a really important factor to deal with, and that's challenging. I can't say there's this like silver bullet on a way to do that. There's, a lot of the things that we've already talked about are the things that you do for that and can improve it, but you have to deal with that or you're always going to have digestive issues. And frankly, what I see even with the fecal transplants is that they're good, and I've got patients who have to do them repetitively because you still have the same underlying neurological problem that's keeping it from stabilizing, essentially. Wow. And so you got to work, like I said before, you got to work on the body and the brain.
Yeah. Wow, it's amazing. Well, it makes you realize, at least for me, and I think a lot of people are like this, when you get nervous or whatever, your stomach automatically responds.
Oh.
Yeah,
no.
And it really
and that mechanism is exactly, and that's exactly what I'm talking about. That's exactly why so it's like, when you have that nervous stomach and everyone says it's in your head, it is, but it isn't. You know what I mean? Like the physical symptoms are real, but it's really coming from a dysregulation of those two systems.
Wow.
Is why that comes there.
Is there a way you can get rid of that? Because that's like whenever I get nervous, I feel like I have to poop every time. Every time.
There are some things called, so the vagal nerve is what kind of modulates that, at least with the gut. And so there are vagal nerve exercises that do help. There's they're coming out with some devices to do it too, but I won't say they're consistent in their effectiveness. But what happens is you can do things like deep breathing, humming. You can actually take like an electric toothbrush and vibrate the roof of your mouth, kind of near that gag reflex. That will stimulate the vagal nerve. You can do
weird.
that. Yeah.
Don't worry about my electric toothbrush.
Singing is also a really good way to do it. But if you do all those things kind of consistently, what I tell people is, what a kind of an easy routine is that, because it's something you have to do kind of consistently to improve that. But even if you have anxiety, you get real nervous, or you have a social anxiety, those types of things, doing this can help tremendously. It also helps a lot of people with autoimmune disease too, to do this, because oftentimes there'll be disruption. Some of the studies with vagal nerve stimulation is that it improves some of the autoimmune conditions too, which, there's a tremendous amount of research on this. But, when most of us try to brush our teeth at least twice a day, right? So if you get an electric toothbrush, and after you brush your teeth, just do that vibration of the roof of your mouth for a minute. Do some gargle for a minute, preferably with like some warm water. It doesn't have to be hot, but just a little bit warm. Try to gargle I know that's really hard when you think about it, to gargle for a minute, but just do as much as you can. Yeah. And then do a minute of deep breathing, real diaphragmatic breathing. Use your chest and do those deep breathing exercises for a minute. And if you do that twice a day, every day, you'll definitely make some improvements there.
Yeah.
Really effective.
Oh, well, I'll catch myself not realizing, like, I'm barely breathing,
I shallow breathe all the time. I'm like,
oh, I know. And then you just realize, you take a second and just take a few deep breaths even. It does make a world of difference.
I think it's important to think about your brain and your neurology is almost like a muscle. And so the way you get it better is you stimulate it. And so that vagal nerve is a cranial nerve, and it goes into that area of the gag reflex. And that's why a lot of things you do are in that area. But, that's the cool thing, is whatever the weakness is, you just try to strengthen it.
Yeah. That's fascinating.
It's so fascinating.
It really is. Well, and I think that, again, a lot of people really don't realize that whole you are what you eat, and how everything is integrated. And I know for myself with my RA how much different I feel when I eat better, and remember to deep breathe and do my yoga and do all the things that are kind of incorporate some of the things that you've touched on. It's, it makes a difference.
Absolutely. And a lot of these developmental issues can even manifest in things like depression and like anxiety, where there's not, you may not have ADHD, you may have not gotten full autism, but even just other issues with mental health can be traced back to neurodevelopment. And a lot of times I'll see adults with these, or even after there's been an injury, like a stroke or concussion, we can see some of these primitive reflexes come back. So, always, if you're really struggling in those areas, look at not just neurologists, sometimes you got to work with neurologists to make sure there's not any major, issues, but also functional neurologists, which, kind of basically it's the functional medicine guys of neurology. And that's what they look at, these functional issues and strengthen them.
Nice. Well, thank you so much, Dr. Z. Matthew Zaderman, for joining us again. And if you think of something too, you're like, Vera and Heather probably want to know about that. Feel free to be like, you could do a podcast on such and such. Or we might very well be contacting you because, Heather's son Baker is what? How old is he now?
2.
2. Okay. So.
Okay, great. Yeah. No, sure. And, I don't, absolutely. And depending on it, we could even do, you could probably do a whole one on the primitive reflexes, really. Pretty fascinating. So
I never would have thought of that. And then your website is healthytallahassee.com, right?
Right. That's correct.
Okay. And Tallahassee is the capital, Florida.
Well, everybody,
Orlando and Miami. Tampa. So if you need to Google how to spell it.
Yeah, there you go. But thank you again, Dr. Z, for joining us. That was really enlightening and just cool. Yeah, very cool.
No, I really appreciate you guys having me.
Of course. And we'll have you back, I'm sure.
Yeah.
Okay, great.
Especially as Baker gets older.
It's driving me crazy.
Help me.
At that age, that is normal.
Yeah, right? Too.
Yeah, maybe we should talk about the effects of why he is so attached to Brad and not me.
Aww. Well, it happens.
My daughter is all my wife. And
okay, because usually, it's the opposite parent. So I'm like,
yeah.
Yeah. I know.
No. It's it will change too, But my daughter is obsessed with my wife, and then half the time she's telling me to go away.
I hear that all the time.
Go away,
So
Daddy.
I feel you. I feel your pain. And then I'm like, fine. When you try to manipulate me when you become a teenager, then I'm going to remember this.
Go
That's
away.
right. Exactly. Go away. Yeah.
I don't need you.
Awesome.
Well, thank you so much, and we will talk to you later.
Yeah.
Okay. Thank you so much.
All right, bye.
All right. Bye.